Good evening, everyone. Happy Friday. This is Nurse Eunice with Florida Training Academy. And in tonight's video, we're going to be reviewing 50 of the Home Health Aide practice exam questions with the answers. As we always do, we'll give you a few moments to receive your notifications and we'll get started shortly. Hey. Welcome in. If you are new to our channel, go ahead and enter your name and maybe the city, the state, or the country that you are viewing from, and we'll get started in 10 seconds. All right, so let's begin with our first question. Question number one. What is the primary role of a home health aide? Is it A, to administer medication, B, provide skilled nursing care, C, assist with activities of daily living or ADLs, or D, diagnose medical conditions? And this should be an easy one for everybody. And hold up, let me show this. Congratulations! You passed both part of your exams, specifically passed my written skills test because of you. I'm so appreciative of you also. And congratulations, Chocolatey. We're so proud of you. Everyone give her kudos. All right, and so for this response, if you chose C, you have the correct response. So C, the primary role of the home health aide is to assist clients with activities of daily living, such as bathing, dressing, and grooming. All right, question number two, a home health aide should do which of the following when providing oral care to a client? Is it A, use a sponge tip swab for unconscious clients, B, place the client flat on their back, C, use alcohol-based mouthwash, or D, avoid cleaning the tongue? What do you want to do when you're providing mouth care as a home health aide? I know, we're so proud of you. All right, so Nina says C, Jimaline says A, Korea says A, Buck says A. So I see a lot of A's and I see a lot of C's. So this will be my question, everybody. How would you apply the alcohol-based mouthwash? You would do so by using a sponge tip swab. So the little stick with the sponge on the end, we'll usually dip that in the mouthwash, and that's what we'll use to clean the inside of our patient's mouth. Remember, for patients unconscious, you turn them to the side to clean their mouth in a home care setting. If you're in the hospital, we would have suction equipment, etc. So it'd be okay to have them in a semi-Fowler's position. But in home care, providing mouth care to someone who's unconscious, turn them to the side. Don't put a whole bunch of solution in their mouth, just enough to wet the tip of the sponge. And then when you get through cleaning, you can take a dry sponge to remove the residue, or you can take like maybe a cloth with a tongue depressor. You put that in their mouth to get out whatever secretions that have accumulated in their cheek area. Question number three, which of the following is a sign of dehydration in the client? Is it A, increased urine output, B, clear urine, C, dry mouth, or D, increased appetite? This is so easy. I know you all are going to get this one. Yes, the Rochester family and Chrissy and Nicole, you are absolutely right. And Kelly and Jessica and Vivian and Collins and Buck. So yes, that dry mouth is a sign of dehydration. And so other signs would be dark urine. And then whenever it gets severe, we're going to have the decreased urine output instead of increased urine output. Question number four. When transferring a client from a bed to a wheelchair, what is the safest position for the wheelchair? Is it A, parallel to the bed, B, at a 45-degree angle to the bed, C, directly in front of the bed, or D, at the foot of the bed? Let's see. All right, looks like Ketty says B, Lewis says D, Chrissy says D, Jessica says B, Kelly says C. So we pretty much chose every letter of the alphabet except for A. And so the next image is going to help you better understand how the wheelchair should be placed. Specifically for the prometric CNA exam, it doesn't matter whether or not you have the wheelchair at the head of the bed or at the foot of the bed, as long as the wheelchair is at a 45-degree angle. So if you chose B, position the wheelchair at a 45-degree angle provides better support and easier transfer. You are absolutely correct. And again, when you're transferring somebody, it doesn't matter if for most states, it doesn't matter if the wheelchair is at the head or at the foot, wherever you have the most room in order to transfer them. Question number 5, which of the following considered a normal pulse rate for an adult? Is it 40 to 60 beats per minute, 60 to 100 beats per minute, 100 up to 120 beats per minute, or 120 up to 140 beats per minute? What is the normal pulse rate for an adult? I know our patients who are at home are going to receive great care just based upon the answers that you are giving us. And so you all know that a patient's normal heart rate is 60 to 100 beats per minute. And if you notice there, the most common pulse that we will be checking will be the radial pulse. And the radial pulse is at the base of the thumb. And you feel for the pulse with 2 or 3 fingers, never with your thumb, because your thumb has its own pulse. Question number 6, a client on bed rest is at risk of which of the following conditions? Is it hypertension, B, decubitus ulcers, aka bed sores, C, diabetes, or D, asthma? All right, this is so easy. We're not even going to wait for this one because I know this, you're all going to give it to me 100% correctly. So number 6 is the letter B. Clients on bed rest are at risk for developing bed sores, also called decubitus ulcers, due to prolonged pressure on certain body areas. And so bony prominences are anywhere where bone is touching bone or bone is touching bedding. So when you have a patient laying on their back, of course, their coccyx, their sacrum, their tailbone will be a common place for pressure ulcers. Don't forget about the elbows. If you have them laying on their sides, well, then the shoulders, the actual hip, and what you don't think about is the inner areas where the thighs and the toes are touching. They can also get pressure sores there too. And of course, the heels if they're laying flat on their back. So when we talk about prolonged a person laying in one area for too long, whenever you're giving your bath, you're also assessing their skin. So just make sure you look for any discolored areas, not just reddened areas, because darker complexion patients may not turn red, but it could have some other discolorations, like maybe a pale area or an area that is painful to touch. Question number 7, when should hand washing occur during a home visit? Is it A, before and after direct contact with a client, B, only after contact with the client, C, only before contact with the client, or D, hand washing is not necessary if gloves are used? Right. And I know that you all are safe caregivers and you're going to prevent infections. And the way that you prevent from bringing germs into that person's house is that you do A, you're going to perform hand hygiene before you provide care. And then to make sure you don't take those germs back out, their germs, to your car, you're going to be performing hand hygiene on your way out the door. So you perform hand hygiene before and after direct patient care. Question number 8, when assisting a client with dressing, the home health aide should A, choose the clothing for the client, B, dress the client without asking for input, C, always start with the affected limb, D, allow the client to do as much as possible. I see D's, I see B's, I see a lot of D's, and you all are absolutely correct. So our job is to keep those patients as independent as possible for as long as possible. So you want to do D, promote independence by allowing them to pick out their clothes, to help dress if they can. And remember, whenever you're dressing somebody with a weak arm or a weak extremity, you always dress that extremity first, and then they can help you with their stronger extremity. So always dress the weak arm first or the weak leg first if you have a person with a deficit on one side of their body. Question number 9. A client's blood pressure reading of 150 over 90 millimeters of mercury is considered A, normal, B, hypotensive, C, hypertensive, or D, irrelevant. I know you're proud of yourself because you know so many of these answers to the questions. You got to be proud of yourself because I'm proud of you as I'm watching you enter those correct responses. If you chose C, you understand that the systolic blood pressure range for most facilities is 100 up to 140, and then the diastolic is 50 to 80. So if you put these two numbers, they're about 10 degrees higher than the norm for both the systolic and the diastolic. Therefore, we consider this patient as being hypertensive and they should be monitored closely. Question number 10. How should a home health aide handle soiled bed linens? A, shake them before placing in the laundry. B, place them on the floor. C, hold them away from the body. Or D, reuse them if they appear clean. So the fact that it says soiled, I don't care if they appear clean, they are soiled. So we're never going to do D. And so for question number 10, that is correct. All right, C. Soiled linen should be handled with care, holding them away from your body to prevent contamination. Remember, we have this gastrointestinal germ called C. diff or Clostridium difficile. So if you are taking care of a patient who has a very foul smelling diarrhea, liquid bowel movement, and your legs touch those bed linens, and now you go and take care of another patient who may be on chemotherapy, who may have a weakened immune system, and your legs touch their bed, you have transferred that germ from one person to another person just because your uniform is contaminated. So everything should be kept away from you. And whenever you are in a person's room, try to make sure that your uniform doesn't touch anything. Otherwise, it becomes a carrier also. Question number 11. What is the best way to communicate with a client who is hard of hearing? Is it A, shout, B, speak slowly and clearly, C, use medical terminology, or D, avoid eye contact? Your patient's hard of hearing. What do? Yes, you want to do B. Speak slowly and clearly. Avoid medical jargon. You young people will walk into someone's house and be like, hey, you're NPO. That person doesn't know what that means. Speak full sentences and also slow down your speech. I'm from the South, so we are Southern and we speak really fast. You cannot do that. You can't speak that way when you're talking to someone who's elderly. Slow down and make sure they understand what you are saying. Question number 12. A client with diabetes should have their blood sugar monitored regularly because A, it can cause immediate weight loss. B, blood sugar levels can fluctuate slowly. C, high blood sugar levels lead to asthma. Or D, blood sugar levels can fluctuate widely. What do you know about your diabetic patients and why we monitor their blood sugar levels? I think I see some B's. I see a D. I see some B's. I see some more D's. And so I'm revealing the answer in 3, 2, and I tricked you. So it is not B. Their blood sugars don't fluctuate slowly when they have diabetes. That's why we have you checking their blood sugars before meals and at bedtimes, because their blood sugars are all over the place. That's why they're getting insulin and anti-oral diabetic agents such as glyburide. So clients with diabetes may experience significant changes in blood sugar levels, and that requires regular monitoring. That's why we also have you check their blood sugars before bedtime, because if it's already nighttime and their blood sugars are lower than normal, there's a possibility they won't wake up. So you make sure you check those blood sugars if that's part of your responsibility in your facility, and that usually our diabetic patients who are allowed to eat are given a diabetic snack, and a bedtime snack, and that makes sure their blood sugars don't crash at bedtime because their insulins are still working within their body. So some of the common symptoms of hypoglycemia include shaking or tremors, rapid heartbeat, anxiety and panic, hunger, mouth tingling, sweating, or we call it diaphoresis. They may have a headache, they become nauseous, and then they can have dizziness, weakness, and become very hard to arouse. So if your diabetic patient is exhibiting any of those symptoms, it may be a good idea to get that nurse in there. Even if it's not time to do a fingers check blood sugar, your nurse will have the ability to call the doctor and to get a finger stick ordered, before time if needed. Question number 13. The proper position to place a patient for, the proper position to place a client for a bed bath is prone or high Fowler's or supine or Trendelenburg. The options are prone, high Fowler's, supine, or Trendelenburg. You are at Miss Nancy's house and you're going to give her a bed bath. What is the best position for her if she doesn't have any other illnesses or conditions? You're just giving her a bath. Oh, I'm so happy over here. Yes, team, yes. So pretty much everyone chose C, supine position. The supine position allows the client to remain comfortable while the home health aide assists with the bed bath. So when you think of supine, take the U out, the person is lying on their spine. So they're pretty much flat with the pillow beneath their head while you're giving them that bath. And it makes it easier for them to turn because they're not elevated. Question number 14. Which of the following is not a sign of infection? Is it A, fever, B, redness, C, swelling, or D, bruising? Which is not a sign of infection? I'll be revealing the answers in 3, 2, and yes, everybody. Bruising is not a sign of infection, but fever, redness, and swelling can be. Bruising can occur due to some medications which thin the blood. Maybe the person had a recent fall or they bumped into something. Or if they were recently released from the hospital, then maybe they had an IV line or intravenous line. And because that intravenous line infiltrated or the medication seeped into the surrounding surfaces and left the vein, that could also cause bruising. Anytime something doesn't look right, of course, you're going to notify your nurse. Question number 15. When assisting a client with ambulation, the home health aide should walk A, in front of the client, B, behind the client, C, on the client's weak side, or D, on the client's strong side. I see some D's, I see C's, I see B's. I'll give you about 5 more seconds. All right, so we're revealing the answer in 3, 2, and whenever you are walking someone, you want to be on their weak side. You're supporting their weak side. So the correct response is C. The home health aide should walk on the client's weak side for support and added balance. Question number 16. A home health aide suspects that a client is being abused. What should the aide do first? A, confront the abuser. B, document and report the findings to the supervisor. C, ignore the situation. D, ask the client if they want help. Looks like we have about 30 correct responses. Let's see if we can make it to 40. Hold up, we have another one. I gotta find it. Everybody give Amy applause. Hi, Nurse Eunice. I want to thank you for your videos. I was able to pass my CNA exam. You are so welcome and congratulations. You all make me so proud and so happy. All right, so we have 2 CNAs on the actual live today. So we appreciate you both, and we're happy that you both passed your exams this week. And for question number 16, if you chose B, you understand that CNAs, nurses, home health aides, we are mandatory reporters. So the proper course of action is for you to report the suspected abuse to the supervisor, or the appropriate authority, because we have to make sure that this person is taken care of when they're not in your care. So you would report it to the nurse, and then the nurse can follow through and report it to the authorities, and also have maybe a case manager come to that home to see what assistance the family or that patient needs. Question 17. Which of the following is the correct way to remove gloves after providing care? Is it A, pull from the fingertips, B, remove by the cuff, C, use scissors to cut the gloves? No one would ever do that. D, turn them inside out while removing. And thank you all for being supportive of each other. I just love that. If I had time, I'd have a Facebook group with you all, but I would probably not be on. So I don't want to have a Facebook group, and I wouldn't be able to get on and assist you all. So, but that'll be something I'll consider in the future when I have more help. So for question number 17, if you chose D, you understand that when you remove your gloves, the first one you pinch from the palm and pull it off. You secure it in your other gloved hand, 2 fingers under, take your other glove off. So when you're removing your gloves, you're removing them by turning them inside out to make sure that you do not contaminate yourself. Question 18, which of the following clients is at highest risk for falls? Is it a person with cellulitis, a person who walks independently, a client with no history of falls, or a client with a recent hip surgery? Who is most likely to fall? Who do you need to watch more closely? Who do you need to assist? Everybody gave the correct answer. Anytime someone's had a surgery, they're automatically they need assistance because they could have some sedatives in their system. They're taking pain medications, but for this one in particularly, they've had surgery on an extremity, so that extremity is going to be weaker than normal. So a client who has had a recent surgery, such as a hip surgery, is at a greater risk of falling due to pain and weakness. So that means you're going to be right there helping them up. The nurse, unless you're on a surgical floor and you have been specifically trained, anytime someone is post-op, the nurse is always supposed to walk them first. It's never going to be a CNA or a home health aide's duty to walk the person the first time. For example, if you're walking a patient and they haven't gotten up before, they can faint, or I've seen it happen too many times, they start hemorrhaging or bleeding from their surgical site. So you could be there to assist, but if it's their first time walking, that is not your duty if they're post-op. Question 19, when measuring a client's radial pulse, the home health aide should A, use the thumb, B, count for 15 seconds and multiply by 4, C, count for 30 seconds and multiply by 2, or D, count for 1 full minute. I don't care how annoying it is, do it by the book. Don't just be guessing and making up numbers. So if you chose D for 19, not only would you pass your home health aide examination, you'd also pass your CNA examination. So whenever you go and apply, whether you have your CNA license or you are a caregiver who has maybe personal care experience because you took care of a family member, when you go and apply at these home health agencies, they also give you a test. So it may not be a state certification, but they're going to give you a test similar to this in order to see if you have the knowledge to safely care for a person at home. So the test does have a purpose because as a CNA, you can work in both facilities, but you can also work in a person's home as a home health aide. However, if you're only a home health aide, that usually means that you cannot work in a hospital type setting because those settings require a CNA license. So I hope that helps you understand the differences in the two job types. Question number 20. Which of the following is a sign that a client may be experiencing a stroke? Is it A, sudden headache? It says, excuse me, sudden severe headache. B, gradual onset of nausea. C, sudden increase in appetite. Or D, steady pulse. No, these are not the typical stroke symptoms. So which of these would indicate that someone could be having a stroke? And I see a lot of correct answers. Elise, Jessica, the princess, Barb's, Nikisha, Chrissy, shopping with Yadira, Taria at Avon, Vera. You are absolutely correct. So think about that hemorrhage. If someone's having a bleed in the brain, an aneurysm, the correct response is A. A sudden severe headache can be a sign of a stroke, bleeding in the brain, and requires immediate medical attention. If you're in home care, that means you're calling 911. And then after you call 911 and that person is taken care of, that's when you can notify your nurse and a home health agency. Question 21. When assisting a client with range of motion exercises, the home health aide should A, push the joint beyond the point of resistance, B, perform the exercises rapidly, C, support the joint and move it slowly, D, perform exercises only on this client's strong side. Which is going to be the safest and the most comfortable for the patient that you're performing the range of motion activities on? And that is correct, everybody. You want to support the joint and move it slowly. Look, we have a full video playlist. It may be hard to find so many videos, but whatever skill you're looking for, type in the skill and then put Florida Training Academy behind it. We have a full playlist of not just written exam prep videos, but also of our clinical skills videos. And so if you need help with passing your CNA exams, we're there for that too. We're right here for you. So the answer is C. Range of motion exercises should be performed slowly and gently, supporting the joint to prevent injury. Question 22. What is the first step the home health aide should take when a fire occurs in a client's home? Is it A, call the fire department, B, move the client to safety, C, try to extinguish the fire, or D, close all windows? I see an A, I see a B, I see more B's, I see a lot of B's. So the general consensus is going to be yes, B. We want to race. So the safety of the client is the top priority, whether the fire's in the home, if it's in a hospital, if it's in a nursing home. The acronym you want to remember is RACE. And RACE stands for rescue. Get that person out of harm's way. After you rescue them, that's when you can pull the alarm if you're in a facility. If you're in a home, that is when you can call 911. C, close off any doors. And don't forget, if you can't evacuate, you want to close off the doors in order to slow down the fire. And E is extinguish. And E can stand for two things. If you have a fire extinguisher, you want to pass, and pass stands for pull the pin, aim at the base of the fire, spray, that means you pull back on the nozzle, and you sweep backwards and forward. But if you cannot extinguish the fire, you need to exit. So E can stand for one of two things, just depending on how severe that fire is. Question number 23. A client who is bedridden should have their position changed every 6 hours, 4 hours, 2 hours, or 1 hour. What are you thinking, team? And because I know you all are awesome caregivers, you know this was an easy one, and you knew it was C, every 2 hours or as needed. If a person complains of pain before the 2 hours, don't have them sit in that same position for too long. Go ahead and reposition them. Now, it gets a little challenging. We're trying to get them up out of bed because they need to be out of bed to expand their lungs. And as soon as you put them in the chair, they're like, oh, I'm ready to get back in bed. That may be a little more challenging, if you can encourage them to sit up for about an hour or so. But even if they're sitting up, that means their tailbone is getting a lot of the pressure from them sitting upright. So hopefully they have a reclining chair that you can utilize to help take some of the pressure off of their tailbone. Question 24. A home health aide is providing care to a client with Alzheimer's disease. Which of the following techniques is most appropriate? Is it A, correct the client when they make a mistake? B, ask multiple questions at once? C, rush through the care to prevent agitation? Or D, give simple one-step directions? Nicole, Michelle, Chrissy, Rita. That's right, everybody. Just follow along because if somebody has issues with remembering things, you are not going to overwhelm them. You're going to do D. You're going to give simple one-step directions in order to help the client to understand and to follow the instructions. Question 25. When helping a client with a hearing aid, the home health aide should A, clean the hearing aid with water, B, turn off the hearing aid when not in use, C, store the hearing aid in a warm place, D, turn up the volume to the highest setting. Ow, just thinking about that hurts my ears because when you start adjusting the volume on the hearing aid, sometimes they make a loud pitch noise. It's like a really loud sound. So if you have a client with a hearing aid, I need you to do two things. Number one, you're not a hearing aid tech. You're a home health aide. So they should be teaching you how to use their equipment, or all you want to do is keep it safe. B is turn off the hearing aid when it's not in use to preserve the battery life and to help maintain its functionality. But what I want you to do also as a home health aide is that usually there's going to be a container, looks like an earpod case. There may be a container that the hearing aids came out of. Make sure that when you remove them, that you put them back in their case so they can be recharged and for safekeeping. Question 26. What is the best way to prevent the spread of infection in a home care setting? Is it A, wear a mask at all times, B, avoiding sick clients, C, practicing good hand hygiene, or D, using only sterile gloves? Oh, you all knew this answer before I got finished with all the options. We know that a home health aide or a CNA, they're not allowed to perform sterile techniques. Therefore, they would not be using sterile gloves. So the response is not D. That leaves the second best option would be C. Good hand hygiene is the most effective way to prevent the spread of infection. And so we're going to 50 questions tonight. So we have probably about another 30 minutes left. And so if you stayed this long, go ahead and give us a thumbs up, like the video, share the video. And if you haven't subscribed to our channel, please subscribe. This weekend, I'm doing a video on suffixes, prefixes, practice questions. We have the wonderful Gina. She's coming to help us also. She's translating videos from English to Spanish. We have Siska, who's translating videos from English to Haitian Creole. So we are expanding our team to make sure that we can help a wide variety of students become caregivers, whether it's CNA, home health aide, or nursing. So go ahead and give us a like and a thumbs up, and we appreciate you. All right, question number 27. Hello, Vera from Canada. Question number 27. A home health aide observes that a client's urine is dark and concentrated. The aide should A, encourage the client to drink more fluids, B, restrict the client's fluid intake, C, document the finding and continue to monitor, or D, report the finding to the nurse. You all got to see my face. I am so happy you did not step outside your scope of practice, because even though A isn't wrong, A doesn't notify the nurse. So yes, the correct response is D. Dark and concentrated urine may indicate dehydration or another health issue, and it should be reported to the nurse. And here we have our little urine color scale. If someone's overhydrated, let's say they're in the hospital and we gave them a whole bunch of IV fluids, that means their urine's going to be really, really, really pale. When we start weaning them off of those IV fluids, it can be fair, a light yellow color, but with different types of medications or with patients who don't drink enough fluids, their urine can become all the way down to dark brown. And dark brown urine could be an indication that your patient has urosepsis. That means that not just their urinary tract is infected, but now their kidneys and their bladders infected also. So that's why when someone has concentrated urine, you want to notify the nurse in addition to encouraging them to drink more fluids. Question number 28. We're providing foot care to a diabetic client. The home health aide should A, trim the client's toenails regularly, B, soak the client's feet in hot water, C, report any cuts, blisters, or sores, D, apply lotion between the toes. That's right. We live in Florida and we have our sandals on all the time. So when I am 80 and I'm asking you to put lotion between my toes, I hope that you watch one of my videos and you're going to say, no, Miss Eunice, we cannot put lotion between your toes. We cannot do D, because if we do, we put you at risk of getting a fungal infection. So the correct response, everybody, is going to be C. Diabetic clients are at an increased risk for foot infections, so any cuts or sores should be reported immediately. I don't care if it's not a diabetic patient. Anybody who has something abnormal on their feet, you have to report it to the nurse, because some patients could have circulation problems such as peripheral neuropathy, or they can have congestive heart failure that makes their legs and their feet swell, and so they have circulation issues. So if you notice anything abnormal, regardless of the patient's diagnosis, notify your nurse. Question 29. A client with difficulty swallowing is at risk for A, vomiting, B, aspiration, C, dehydration, or D, high blood pressure. Difficulty swallowing. Revealing the answer in 3, 2, and yes, it is B, aspiration. Aspiration occurs when food or fluid enters the airway, which can happen when the client has difficulty swallowing. You want to encourage them to cough. Do not leave them until the nurse is in the room and the nurse has had time to evaluate that person. A way to prevent them from aspirating is to sit their little tails up. I know they don't like to sit up. They want to eat while they're reclining, and you don't want to tick anyone off. But this is my rule of thumb. Let's say the patient's name is Nancy. All right, Miss Nancy, it's time to feed you. Let me sit you up. I'm going to put a pillow behind your back to get you upright. I know that doesn't feel too comfortable, and I promise as soon as I get through feeding you, I will lay you back a little bit. And you all know we can't lay them flat after they get through eating, because if we lay them flat with a full stomach, they could vomit, they can have reflux, and then if they vomit while they're laying flat, then of course they're going to aspirate. So here's my rule: upright with meals, slightly back after the meal for about 30 minutes to give the time food to digest, and then if they want to lay flat or go lower in the bed, they can do so 30 minutes later to give their food time to digest. Question number 30. When should the home health aide wear gloves? Everybody knows this one. Is it A, only when providing personal care, B, when assisting with feeding, C, always regardless of the task, or D, when handling blood or body fluids? And we're just going to go straight to the answer because this one's super easy. For 30, it is D. Gloves should be worn whenever there's a risk of coming into contact with blood or bodily fluids to protect both the aide and the client. Question 31, a client who requires assistance with eating, dang it, I gave you the answer, should be positioned A, in the supine position, B, in the Trendelenburg position, C, sitting upright at a 90-degree angle, or D, lying on their side. And because I just gave you this answer, I'm going to go straight to it because we all know that a 90-degree angle would be C, and we refer to that as the high Fowler's position. So positioning the client upright reduces the risk of choking and aspiration during meals. Question 32. Let's see if you can get this one right. What is the first action a home health aide should take if a client falls? Is it A, assess the client for injuries, B, leave the client to get help, C, help the client to stand up immediately, or D, call 911? You have a patient on the ground. What do you do first? I see D, A, a lot of C's, D's. I see another A, I see a D. I think I saw, oh, now you all got it. Yes. This one's different. It needs to be A. And so let me explain to you why you want to assess the client first. Because what if the client's in cardiac arrest? So just because someone falls doesn't mean that they still have a pulse, that they're still alive. So you want to do your, hey, are you okay? Hey, are you okay? And then you can call 911. Otherwise, you need to be starting CPR and then calling 911 while you put them on your speakerphone on your cell phone. So when someone falls, you want to assess them. And it's a quick assessment, just making sure they're still alive, they're still responding to you. And then if so, you're going to call 911 for assistance to get them either back into bed or to get them assessed until the nurse can get there. Remember, this particular quiz is for home health care. And so there is a nurse that can usually come out in an emergency like a fall. Question 33. A home health aide is caring for a client who is incontinent. The aide should A, use a catheter to prevent accidents, B, change soiled linens as soon as possible, C, limit the client's intake, D, ignore the situation if the client is embarrassed. So you have a person who is incontinent. Incontinent means that they cannot control their urine. So that means that they're wet. If a person's wet, how do you prevent them from wetting themselves? So what do you do after they become wet? For this one, the correct response is not C. You as a caregiver can never limit someone's fluids without a doctor's order. That could be considered neglect. So we can't treat them like we treat our kids and just stop giving them fluids at 8 p.m. Hey, it's almost time for bedtime. I'm not going to give you any fluids. You need a doctor's order for a fluid restriction. So for this one, if you chose B, you know that changing soiled linens promptly helps prevent skin breakdown and promotes the client's comfort and dignity. Question 34. A home health aide is preparing to measure a client's weight. The aide should A, weigh the client at different times each day, B, weigh the client at the same time each day, C, have the client hold on to something for support, or D, weigh the client after meals. I see A's. I think I see a couple of B's. I see C's. I see a lot of B's. And B is a correct response. So using the same scale and weighing the patient at the same time each day provides more consistent and accurate weights. And the best weight is taking first thing in the morning. You greet your resident and get them up to the bathroom so they can void, so they can clear their bladder. And then you would get them to the scale. So if you start doing the weights after dinner, that means a person has eaten breakfast, lunch, dinner, and 2 snacks. So they're going to be full of excess fluids, which means that the weight would not be as accurate. Question 35. When preparing a meal for a client with dietary restrictions, the nurse aide should A, offer a variety of foods regardless of the restrictions, B, allow the client to eat whatever they want, C, ignore the restrictions if the client is hungry, D, follow the dietary plan provided by the healthcare team. So you have a patient who has congestive heart failure. They have a condition that involves their heart, and they are always asking you to stop by the store and bring them some potato chips. I know you want to be friends with your client, but you also have to know that salty or processed foods would not be a part of that patient's dietary plan. So the correct response is D. Following the dietary plan ensures that the client receives the proper nutrition and avoids complications such as salt causes fluid buildup. And so, if you're giving a person with cardiovascular disease salty foods, they're going to start to swell. They're going to become edematous. So, encouraging them to follow their dietary plan is important. Question number 36. When assisting a client with personal care, the nurse aide should A, rush to finish quickly, B, follow the client's preferences, C, force the client to accept help, D, complete the task without communication. And we're never going to do D because we are personable and we're going to show empathy, and we're instead going to do B. That is right. We're going to respect the client's preferences because that helps to maintain their dignity and their comfort. Question number 37. A home health aide is providing care to a client with a urinary catheter. The aide should A, ensure the catheter tubing is kink free, B, tug on a catheter to check for blockages, C, remove the catheter when it's full, D, position the bag above the bladder. And we'll be revealing the answer in 5 seconds. 4, 3, 2, and here we go, team. Yes, so in this particular image, this person's not bedbound. She has a catheter and she is able to move about in her wheelchair. And so even when she's in her wheelchair, you want to make sure that the tubing remains unkinked. So the correct response is A. Keeping the catheter tubing free of kinks ensures that urine can flow freely and reduces the risk of infection. Question 38. A client with COPD is experiencing shortness of breath. The home health aide should A. Lay the client flat on the bed, B. Place the client in the semi-Fowler's position, C. Restrict the client's fluid intake, or D. Encourage the client to hold their breath. So COPD, chronic obstructive pulmonary disease. This person retains mucus and they sometimes cough a lot. So this person's now having short of breath probably because their airways are clogged. So what do you want to do? And if you chose B, put them in that semi-Fowler's position, you are correct. Of course, high Fowler's, if that's comfortable, would be an option also. But the semi-Fowler's position helps the lungs expand and it makes breathing easier for clients with COPD. Question 39. When performing perineal care for a female client, the home health aide should clean A, back to front, B, only around the catheter, C, in a circular motion, or D, front to back. How do we clean a female client? All right, looks like I see some B's, I see D's. No problem, Michelle. I figured that. So that's right, everybody. You want to wipe a female in the correct direction, which is D. Cleaning from front to back helps prevent the spread of bacteria from the anal area to the urinary tract. So the way I want you to remember it is we wipe from the cleanest area towards the dirtiest area. That's why even with our baths, we wipe from the cleanest area down towards the dirty area. So it's always going to be cleanest to dirty, or for a female, especially when you're cleaning their genitalia, from front to back is best. Question 40. A client is experiencing constipation. The home health aide should A, encourage the client to limit their fluid intake, B, recommend bed rest, C, encourage the client to increase fiber intake and fluids, or D, give the client a laxative. All right, I'm looking at the responses. And looks like the majority of you have the correct answer. Revealing the answer in 3, 2, and if you chose C, you are correct. So foods that are high in fiber are a lot of your vegetables. Sometimes we can give them total or bran flakes, but if you just give them fiber, fiber bulks up the fecal matter. But if you just give them fiber without fluid, that causes a worsening of constipation. So you have to give them fiber and fluids. The fiber bulks it up, and the fluids help to wash it out and to push it out of the system. So you need to give them both in order to promote bowel movements. Question 41. When assisting a client with a shower, the home health aide should A, leave the client alone for privacy. B, keep the water temperature below 80 degrees Fahrenheit. C, stay with the client at all times for safety. D, use a washcloth instead of soap. All of these were kind of silly answer options. So if you don't get this one right, so we know that if we have someone in the shower, we will never leave them unattended. So we're right outside of the shower door. We bring a chair in there while they're showering, and then just make sure that they have a shower chair in the actual shower that they can sit on in case they get tired while they are showering. So the home health aide should remain with the client to ensure their safety and to prevent falls or injury. Question 42. A home health aide notices bruises on a client's arms. The aide suspects abuse. What is the aide's next step? Is it A, ask the client how they got the bruises? B, notify the client's family? C, ignore the bruises unless the client complains? D, report the bruises to the supervisor? And I know you know this answer, so we're going right to it. For this one, the correct response would be D, because we are, again, mandatory reporters. So any suspected abuse must be reported to the supervisor or the healthcare professional immediately. Question 43 involves diapering. When changing an adult brief for an incontinent client, the home health aide should A, change the brief only if it's completely soaked. B, change the brief regularly, even if it appears dry. C, avoid using any skin protectants. D, leave the client without a brief for a while. This one is tricky. I know, I agree with all of you all. I think it's B and D too. All right, so some of your patients are only going to be incontinent at night. And if they only are incontinent at night, and if you talk to your nurse about it, I feel it's okay for them to go without a diaper during the day hours. They can wear their regular underwear. So I'm okay with B or D. But if the nurse says no, they have to keep their diaper on, or if the family member requests that they keep their incontinent brief or diaper on, then you would do B. You want to regularly change the brief, even if it appears dry, because that helps prevent skin breakdown and discomfort. And if you need to see a video on how to change an incontinent brief, I have those on my channel. I have one with me changing the brief on a male, another one on a female mannequin, and I show you how to change the pads also. So when you look through the playlist, you want to find the playlist for the CNA skills so that you'll learn how to help change those briefs, because it's not something that's often taught in your CNA classes or your home health aide classes. Question 44. The home health aide is assisting a client with a walker. The client should be instructed to A, move both legs at the same time. Means you got this patient hopping. B, do the best that they can. C, keep the walker behind them. Or D, move the walker and then step forward. All right, and the only one that makes sense to me is going to be what you all chose. It is D. The client should move the walker first and then step toward the walker for stability. So it's walker and then step, step. Walker, step, step. 45, a client tells the home health aide that they feel lightheaded when standing up. The aide should A, have the client stand quickly, B, encourage the client to sit down immediately, C, ignore the complaint, or D, call the doctor immediately. Close, Michelle. Go back and read it again. I know we have B's, we have C's. So for this one, the correct response is going to be, and looks like my computer froze a little bit. Remember that a home health aide or a CNA does not report to a doctor. So that's why D is not the correct response. For this one, the correct response is going to be B. Lightheadedness may be a sign of orthostatic hypotension, which means that the pressures dropped when the patient stood up. The blood went down into the person's legs. And so the client should sit down immediately to prevent a fall. A good way to prevent the orthostatic changes is you never want to get someone out of bed and have them stand up immediately. You get them out of bed, ask them to sit to the side of the bed for at least a minute. That gives you time to put on their shoes, and then you want to check on them. Hey, are you dizzy? They're going to say no. Stand them up and ask that question again before you proceed with walking them to wherever their destination is. Question 46, and I hate the fact that we're almost done, you all. I love being with you. Question 46, the correct way to remove a gown after caring for an isolated client is to, do you want to pull it over your head? Do you want to tear it off quickly? Do you want to untie the gown and then roll it away from your body? Or do you want to reuse the gown? All right. I know what we had to do during the pandemic, but D should never be the option. So don't choose D, you all. What do you do? What's the correct way to remove a gown? Yes, it is C. You want to untie it. The gown should be removed carefully by untying it and rolling it away from the body to avoid contamination. So pretty much everything else is going to be rolled up in that gown. Question 47. A client asks the home health aide for advice on taking medication. The aide should A, offer their personal opinion, B, refer the client to the nurse or doctor, C, read the medication label for the client, or D, recommend over-the-counter supplements. That's right. They're going to spend so much time with you, and they're going to know that you're in nursing school, and they're going to start asking you all of these questions that not one time have they asked their doctor, their nurse, or their pharmacist. So you stay within your scope of practice. When they're asking you questions about medications, I need you to do B. I need you to advise them that they should talk to their healthcare professional, their nurse, their doctor, or don't forget when they pick up those prescriptions, they also get an opportunity to speak to the pharmacist. Question 48. A home health aide is assisting a client with dementia. The client becomes agitated. The aide should A, raise their voice to be heard, B, leave the client alone, C, stay calm and use soothing language, or D, restrain the client. Let's see. What do you have? And we have a lot of C's. Yes, we're going to stay calm, use soothing language. We want to de-escalate. Whenever someone's agitated, you don't match their energy. If you talk low, it makes everyone else around you talk low also. So keep calm, ask them what the concern is. How can I help you? And sometimes if you still can't get it because they're just mad at you right then, don't internalize it. Don't personalize it. Understand this person has a cognitive disorder. This is part of their disease. And then you can ask the nurse or ask for some additional assistance, especially if you're in a home care setting. There's usually going to be a spouse or another family member nearby. Question 49, which of the following is a sign that a client may be experiencing hypoglycemia? Is it A, sudden onset of shakiness and sweating? B, increased thirst, C, decreased appetite, or D, dry skin? And we'll be revealing the answer in 5, 4, 3, 2, and it is A. So let's go back. For this one, it would not be increased thirst. And I know that gets confusing. So when someone's sugars are high, like when they have diabetic ketoacidosis, that's when they're thirsty all the time and they're urinating all the time. So thirst is hyperglycemia. When someone's blood sugars are low, hypoglycemia is when they have the shakiness, the sweating, and also the confusion. Question number 50. A client's care plan indicates that they are at risk for pressure ulcers. The home health aide should leave the client in one position all day, or B, change the client's positions frequently, C, avoid moisturizing the skin, or D, reduce the client's fluid intake. And you all are brainiacs. You all know the correct response. You all know how to keep our patients safe. So you all also know that the correct response is B as in boy. Frequent repositioning is the correct response. Well, you all, I am going to be online with you all pretty much all weekend. I have made it my business this weekend to do prefixes, suffixes, a practice test, etc., etc., etc. So I am going to be getting off of here right now. But if you want freebies, you can go to our website, which is fltraining.com. And I will see you all tomorrow. Don't forget to like and subscribe. I don't know what time I'm getting on tomorrow. I know that's one of the questions, but I'll try to get on as early as possible. So you all be blessed. Enjoy your night, and I'll see you in the next video. Bye, everybody.